Good evening and welcome to Beyond the Front Page, a show produced by QU Community College for the spring 2022 semester here at the college. This is a show that's broadcast on Spectrum, Verizon Fios, the Auburn Regional Media Access, better known as ARMA, as well as the college's radio station, WIN 89.1. I'm your host, Guy Cosentino. In our studio tonight is Monika Salvage, the project director for the Healing Community Studies that has been looking at the issue of overdoses and how to address gaps in services to prevent more overdoses. Well, the area and region and the nation have been focused, rightfully so, on COVID-19. There have been other fights that are just as important, and one of those that we do not want to lose sight of has been the issue of opioid abuse and heroin deaths, or usage as that may be the case. Over the last 2 years, isolation has brought about an increase in usage, we believe, both locally, regionally, and nationally. And we did have the sheriff on the other day, QU County Sheriff Brian Skank, and when he was here on Tuesday, gave us one of the startling numbers. But even before that, we had tried to book on Monika Salvage to talk to us about what is going on locally. In the city of Auburn, for example, there have been 222 overdoses, up 46% from 152 in 2020, and then 11.8% increase of 136 from 2019. And pre-COVID, these numbers were not good, but as we know, we've gotten some facts from QU County Coroner Adam Duckett that while overdoses may be up, there has been a decline in deaths, possibly because of the use of Narcan that helps reverse the effects of the drugs. So we've asked Ms. Salvage in to talk a little bit about where the healing study is, what's going on statistically, and also what the future here is, because you're in the third, depending on how you do your math, third or fourth 4 years, and we want to know how your good works will continue. So, welcome back to the studio.
Thank you, Guy.
It was to the week when I was going back through my notes, and so I tossed out a lot of numbers, and I know we're going to clarify that, but let's talk about what healing is the project is in the first place.
So the Healing Community Study is a national initiative. It's federally funded by the National Institute of Health to reduce opioid overdose deaths. There are 67 communities involved in 4 counties who have been selected because they have had
4 counties in New York.
In 4 states.
In 4 states. 4 states.
Yeah.
But in New York, there's been a couple of counties.
There are altogether 16 counties in New York State. And we've been selected because we have had a high number of opioid overdose deaths in the past. And what the study looks like, study is maybe a weird name for it because we're not just looking at stuff. We're actually also implementing strategies and interventions to combat what has been happening. So we're looking at evidence-based strategies, which means something that has a science base, that has a research base, to something that has worked in other communities to figure out what could work in our community.
And of the 16 counties in New York, are they all rural? Are they a different mishmash of?
So there's a mixture, but there is a certain, in all the states, there is a certain percentage of rural counties and then more metropolitan counties. But the overarching commonality is that they've had a higher than average opioid overdose death rate.
So New York has 62 counties. What's the closest healing project near us?
The next one will be Cortland County, but they are in the second wave. So we're doing it in 2 waves because we're being compared. That's the research aspect of that study.
So again, I mentioned 3 and 4 years. Could you explain to us where you are? Because the data that you're releasing right now is for the second year.
Correct.
But that really means that you did a year before to collect that data.
Right. So the study is for 4 years. But the first year was basically all the research sites, so all the universities that are involved in all the 4 states getting ready for that study. So we started basically in the beginning of 2020, where it's almost the end of the first year. So you started
right at the start of COVID?
Before, just before.
Well, no, but I'm saying like a month.
Yeah, just before the shutdown.
Because your new year starts April 1st, correct?
Right.
So your final year, is it your final year will be starting on April?
April, yeah.
April, which will go through March of 2023.
Correct.
Okay.
I know it's a little.
Well, it's impact what you're looking for funding, things you funded, and how it all works.
Right.
So, how big an office do you have? I don't mean space-wise, square footage. How large an office is there in Cayuga County?
So, I'm working out of the Cayuga County Mental Health Center, and I have another county employee, a team member, who is our technical assistance coordinator and our outreach coordinator. So, we work out of the county mental health clinic. And then we have 2 part-time contractors, an epidemiologist who's working with us on data collection and analysis out of Cornell. And then we're also working with a part-time consultant who's helping us with partner engagement.
Okay, so 2 county employees. Are you county employees?
Yep.
And so is there a local share to this?
There is not.
Okay, so this runs out of the health department of mental health.
Mental health.
Mental
North
health.
Street. Yeah.
And so when you were on last year, you said the goal was a 40% reduction. I think that's the overall goal at the end of 3 or 4 years. Where are we? Where are you benchmarking where we are?
So, and that's a little different too. It's not necessarily a 40% reduction for each county. It's basically overall in aggregate, so all the counties together from wave 1 who started their implementation earlier and had longer time to implement interventions.
And are you in that group?
Yes.
Okay. Portland's in the next group.
Exactly. So we are comparing the first wave of counties to the second wave of counties who didn't have any implementation so far and who are starting in July. And then those 2 rates are going to be compared.
So who's funding this?
The National Institute of Health through the National Institute of Drug Abuse.
So NIH is doing this. Is the goal, forget reducing rates, I understand that part, but is the goal to develop, whether it's 16 counties or 4 states, best practices so that will be shared? And so, for example, in New York, it won't just be those 16 counties. It will be all 62. Will hopefully...
So the idea is of that grant is to figure out a locally driven model that can help reduce opioid overdose deaths. So it's not that NIH is saying, you have too many overdoses, here is what you need to do. It's really up to us locally with some guidance and some guidelines, and the strategies have to be evidence-based. So there are certain guidance around that. But basically, it's up to our local steering committee, our local partners, whoever is working with us on it to figure out what works in Cayuga County, because it may be very different from what works in Westchester County, for instance, or somewhere else.
So you have some community partners here. Who are they?
So we have a number of partners on our steering committee, but then also who we're working with through our strategies, and that's anywhere from law enforcement, it's treatment providers, it's education partners, it's the courts.
And some of those you've funded. So, for example, we'll talk about that in a few minutes, but Nick's Ride and others you have funded in that.
And again, the funding was more for initiatives that were identified that we would think would help with the reduction of overdose deaths. So this is what we were funding. It wouldn't go to operational expenses.
And I know we're going to get to the trends in a second. Well, it looks like there's an increase in overdoses. The rate of deaths is declining, which is good news.
Yes.
But we'll get to that in a second. 2 years in, where do you think we are? What's your assessment of where you think the Healing Studies Project is right now, where you are?
I think that Cayuga County has been very lucky that we've had the resources of the Healing Community Study, especially at that time when the global pandemic hit, because we were able to continue our focus on opioids when everybody else was focused on COVID. And although it's hard to say after the fact what would have happened if all this work didn't happen during that time, but I think it's safe to say that we would have seen way higher numbers in overdoses and overdose deaths if during the last 2 years, if we didn't have that sustained focus on opioids.
So I don't want to get into COVID because this is not about COVID, but some might contend, because there's been national discussion about this, that COVID has driven some of those high overdose rates. Good news is, again, Narcan and other methods and people addressing the issue. But in your view, has this spike in deaths over the last 2 years? Can you believe, in your mind, do you believe it is directly attributed to the isolation and the results of COVID just shutting down the nation?
Yeah, and I think we have the local data. 2020 was devastating for us, but also national data that suggests that substance use.
Yeah, I'm not saying it's just local. I'm saying this is a national.
Yes, so
problem.
Substance use has been up across the board, and there's CDC data that confirms that, alcohol, all sorts of, prescription drugs, all sorts of substances that people use or misuse, all that has been up. Mental health service needs have been up.
So your organization obviously has been working on this full time, and you're dealing with it. Whether it's regionally, statewide, or nationally, if you went back to 2018 and 2019, if you talked about a health concern in this country, I would find it hard to believe that opioid or heroin was not at the top of the list of issues from a national health perspective. Forget disease, but I'm talking about abuse of drugs and specifically that. Did we lose focus nationally or regionally or even locally on this, or do you think we still had those people out there doing the hard labor?
I think locally we have made some great strides prior to the pandemic because Cuyahoga County has been hard hit. We had over 20 deaths going back to 2017, 2018. And through all the work of all the people that have been involved, the agencies that have been involved, there has been a lot of grassroots efforts in this county. And in 2019, we were down to 9 fatalities, which is still too many, but it was greatly reduced from a few years before when we were like at 26. So locally, I think we haven't lost the focus because there was a lot of grassroots and a lot of families, people involved who wanted to help with that cause. And then when the pandemic hit, and thankfully, through healing, we were able to sustain that focus, but the pandemic has been devastating for people with substance use.
So let's talk about some trends, because you provide some data, and then obviously we heard from the sheriff. So first of all, define for me, the first number I'm going to toss out is this 278. This is the number of overdoses in 2021. Before getting into what the 278 means on a trend line, what does that include for an overdose? It's not just opioids or heroin, is it?
No.
Okay.
Thank God. So that includes all the overdoses that have been reported through Auburn Police, the Sheriff's Department, State Police, and they all report in a common system, so that makes it easier for us to get those countywide data. And that includes anything that has been called in through 911. It has been determined to be overdose related. So that could have been prescription drugs, that could have been polysubstance use where people were taking 2 different substances together that all of a sudden interacted and were,
something from their own drug cabinet that they...
For instance, and it could have been something that was prescribed, but it was taken, say, with alcohol, or it was taken with something else, and now all of a sudden that interacted. It could have been something that was prescribed and it was taken too much. Self-medication has been an issue. So it could be anything.
Did we see people self-medicate more during COVID?
I don't have any data to suggest that, but I think it's safe to say that it is because people were afraid to go to the doctors or were not able to access their normal support systems and healthcare systems. So if you have stuff at home, it's easy to take it. It's easy to take more of it than it was prescribed. People take stuff to alter their moods. And during that whole isolation period, I think it's safe to say that people were probably self-medicating and overusing.
So we've had a trend from 2019, which is pre-COVID, of 179 overdoses. In 2020, when COVID first appeared in March, the number went up to 208, and obviously we're at 278 for 21, and you did give me some of just January's number, and it was 22 overdoses. So if you did that in the math, that you're still on track for that 280, 290 number anyway this year, correct?
Yeah, it's the first month.
But if you went on training, so So would you? So that's the bad news. Those are the cases that we have. Are there any similarities in what the majority of those cases are? Are they? Do you know if there are opioids? Are they?
So yeah. So what we know, and that goes by what officers on the scene
Identify.
determine.
Okay.
What they're suspect. So this is all suspected. But we know, and we've collected that data over those 2 years, 3 years actually now. So we know that about a third of the overdoses that are reported are opioid related.
And it looks like that's been fairly consistent. 25%.
It has gone up actually, because 2 years ago it was about a quarter. Now we're over a third that are opioid related. But that leaves 2/3 of substances that have most likely nothing to do with opioids. So that could be any other types of substances.
And is HEAL only dealing with opioids and heroin?
Well, we're dealing with reducing opioid overdose deaths, but since we're looking at all this data, we're looking at the substances, we know that polysubstance use is a major issue. So of all the people that have passed away and that we have toxicology reports from that we get from the coroner's office.
Oh, so you get that data?
Yeah, yeah.
Okay.
So we analyze that because it comes back from the lab, what substances were involved. So we analyze that, and it shows that almost none of them only have one substance in them. So most of them have multiple substances in them. Almost all of them that are fatal are opioid related. So that's the thing with opioids. Once, it's just more fatal
in
than
that
a lot of the
particular
other
track.
substances.
So David Wilcox did a wonderful article about 2 weeks, no, I guess about almost a month ago now, about just, and I think he titled it "A Perfect Storm: Rising Stats Tell Another Story of COVID-19 in Q County." But one of the numbers in there, and I think he quoted the coroner, Dr. Duckett, fatalities were at 5%, roughly, about 9 fatalities in 2019. It went up a little bit in 2020 to about 10%, 21 fatalities, and then it dropped to about 6% of fatalities, about 16. So you went from 9 to 21 to 16. What do you attribute that to, other than good work of those agencies helping people? Or is that solely the issue or the result?
Well, I don't want to make it sound like they weren't doing good work before. But in 20...
But it takes time to... Some of those agencies were nascent at that point, and they've been growing in their efforts and being able to deal with more individuals in a pandemic. Well,
and that's the thing. So that's sort of throwing a wrench into all this data, because 2020 was just so devastating, and also into 2021. But I think what really helped us, and what we've gotten a lot better at through the efforts of everybody who was involved with healing, was working together and really analyzing our system. Where are there gaps? Talking about those things. How can we eliminate them or make sure that they don't happen that often? How can we make sure that a person moves through the system smoothly? How can we make sure that access is better and timely, and that it's easier for people to access treatment when they're ready and when they want to? And I think that helped a lot, because we have, we looked at individual cases. We did the deep dives into some cases and said, what can we do differently?
So is masks become less common, right or wrong? That's a different issue. As people get boosted, as they get vaccines, do you think that it will be easier to get people into services?
Yes, and most of the treatment providers have been adapting fairly quickly. We have telemedicine, so a lot of that stuff could have happened over the phone or through video chat. People got really creative. A lot of them opened their door. The mental health clinic was open all the time,
right?
As an open access clinic, but also other treatment providers adapted fairly quickly in seeing patients again and making sure that people have the services that they need.
And I think it may have been you, but it may have been Dr. Duckett. You had talked in this David Wilcox piece about Narcan. First of all, for those who don't know, what is Narcan?
So Narcan is a nasal spray that can help to reverse the effects of an opioid overdose. So it basically can save
And it was not, while it was available prior to 2019, it was not widely used.
It was not widely distributed.
Okay.
Yeah.
You had to.
So we had, I think, in 2019 we had 136 cases or kits of Narcan that were distributed countywide throughout that year. Now in the last year and a half, we've distributed over 1,700.
So it is easier to get Narcan now.
Yeah, so we've started a pretty comprehensive Narcan distribution program to really meet people where they are.
So when you were on last year, you talked about pop-up events where you would distribute it. Are you still doing pop-up events? So,
so we're going into areas that have been hard hit. We're going out into towns and villages. We're going into spots where there are a lot of people to train them and to distribute Narcan.
So do we know of any of that 35? Let's pick on the 2021 year. The 35% of opioid-related overdoses. How many of those individuals, or as a percentage, were administered Narcan?
I don't have that percentage because it's not always listed on the overdose log, but we know who administered the Narcan. So it's not necessarily.
By the way, how do you know that?
Because law enforcement uses the OD map, and that's a national system where overdoses are being tracked. They now utilize all that, and so they enter data into who is the first entity that administered Narcan. And so usually it's first responders, right? Because it's either fire department, ambulance.
So are those 1,700
police.
units of Narcan that you've distributed mainly to police and law enforcement?
No.
So how do you know about those individuals?
So law enforcement has their own Narcan. They're
Right.
not getting it through healing.
No, so what I'm talking about is of the 1,700, you may not know of cases of overdose because somebody may have used Narcan.
We only know what's reported.
So, okay. So there might be a larger number of overdoses and a larger number of Narcan. Can you get high from Narcan?
No.
Okay.
No.
So the other spike that occurred here, and you're going to have to explain this. This is something called Molly. What is it, and is it still an issue?
Yes. So Molly is in essence a synthetic opioid, and
Is it illegal? Because I know that's been one of the issues is they changed the chemical makeup and it doesn't comply with the law.
Exactly. So it's sort of like what we had with the bath salts.
Okay.
So it's really hard for law enforcement to trace or to track. It's also hard. It doesn't show up yet in urine screens or anything. So that's an issue.
So that's separate from fentanyl, which is what's been laced in some of the heroin, correct?
Right. So Molly is more a mixture of things. They sometimes liken it to MDMA, which is it used to be ecstasy or that kind of stuff, but it's not really because it has so many different components.
So if we
fentanyl is a straight opioid, synthetic.
So
opioid.
do we know from the 278 cases last year how many were Molly or fentanyl, or is that data we just don't have?
Molly is a little bit difficult because, again, it depends on if somebody tells them what they were taking or, if they can identify at the scene. But fentanyl, we know, is involved in almost all the cases that are fatal. And it's also part when it's listed, again, because oftentimes fentanyl is mixed with heroin. It's mixed with cocaine or in pills that are off the street. So it's really hard sometimes.
And often users do not know that.
And that's the other case, right? Okay. So that makes it hard to separate fentanyl out.
I want to get to stigma, but I'm also being cognizant of the clock. I want to talk about two specific items. One is what you funded and what your future is with funding. So let's talk about, you said that at the beginning that most likely study is most likely a misnomer of some sorts. You are also doing a lot of partnerships out there. So that includes funding, correct? So what are you doing? Give us some examples.
So part of the funding from healing goes to the implementation team, that coordinates that whole effort. And then another portion, I think it's almost $800,000 so far that we have given out to for initiatives in the community. So that could be anything from funding, more peer support services, funding. I'm drawing a blank now.
So let me ask you this question: if an organization gets funding, do they have to put up a match for the funding?
Well, it depends. The funding goes towards, the group identifies something that we can do that could be helpful. So then we figure out, who is the most likely candidate or agency or whatever who could do this. And it's a new initiative that we're tracking. And so we're funding this as startup.
So that's my question.
Yeah.
So that's where I'm going. How do you sustain it? Because at some point, the
Right.
current funding, whether it's NIH, maybe NIH renews this, who knows? But at some point, you have to have sustainability. So how are those projects sustained?
Right. So what went along with coming up with those strategies that we're going to implement and fund was also a sustainability plan for all those things. So we would sit down with the agencies and say, how can we either incorporate what you're doing into your agency, integrate, operationalize. And I'm happy to say that most of those agencies or most of the strategies that we have implemented are able to stay around or stick around or be operationalized.
So in the last 2 or 3 minutes we have, I want to talk about the future of healing because I'm not sure we all grasp this. So does the county right now fund anything on this front?
No.
Okay, so it's important for this fight to continue because these numbers are still high. There's no question about that. But for example, in November, the city of Auburn had a settlement of $280,000 with opioid manufacturers. Where are those? Do you know where those funds are going?
Yeah, so the county is getting opioid settlement funds as well.
So they are. Okay.
Yes,
So the city got their 280. Do you know where that money's going?
I do not know.
So do we know how much the county's getting?
Well, there are several settlements out there. So, and they're all being paid out at different time frames and in different amounts. So I think it's about $1.3 million over different time frames. So 10 years, 18 years.
So your 4-year healing grant is how much money?
It's about $1.3, $1.4 million.
Which would be the equivalent of what the settlements would be.
Yeah, but that includes all the funding for all the agencies also.
I understand. Mm-hmm. But my question is, so what's the county going to do with their settlement money? Have they made that decision?
No, they have not. They had a presentation about it with the budget director about what they know so far.
How long ago was that?
It was it last month?
So it's recent.
Yeah,
it
was
okay.
recent, yeah. And there are new settlements coming.
Right. So is the goal to continue healing in Q County?
Whose goal?
Well, no, I know it's understandable.
Yeah.
Okay, so has there been a discussion at the county level, because this is a funding priority, and I'll ask this question to David Gould in a month. Mm-hmm. Heads up. So where does it, at some point, the county has not put any money into this, it sounds like. And I'm not saying that's right or wrong. I'm just saying it has not been required because the NIH has covered it. The question is now that unless you get another NIH grant or somebody has figured out a printing press at the bottom of the county office building, new funds have to be set aside. Am I correct on that?
That is the hope, yes.
And so are there discussions about that at the county?
There are preliminary discussions about it. Right now they're talking a lot about ARPA funds. And so now the opioid funds the settlement funds have been brought up. The hope is that there will be funds dedicated to at least keep the structure in place that has been working really well, keeping the expertise in the county so we can expand the work that we've been doing for opioids also to other substances, because opioids is not the only issue that we have.
So this is my last question, I promise, hopefully. So a lot of the data developed was during COVID. Mm-hmm. Does this need to continue because you need to have non-COVID data available because we're going to hope that we're not going to have a pandemic in the next 10 to 15 years?
Well, that's the hope, but it's obviously the data has been skewed those 2 years due to the and also for the study due to the pandemic. But I think the issue overall is that there will always be some sort of substance use, and that has to be addressed on a county level. You can't expect the agencies individually to do all that work and figure all that work out countywide. There has to be a county vision that the agencies can work towards and work together on.
We'd love to have you come back, give us an update as more data becomes available and where the future of funding on this. Our guest has been Monika Salvage, the HEAL Project Director through the county, which is an NIH funded initiative to look at heroin and overdoses as well as trends and how to solve these issues, or not solve, address these issues. I don't know that we'll ever solve it, but we'll address it. On Tuesday, we'll have new Auburn Police Chief James Slayton in the studio to give us an update on what his department is doing, especially on nuisance properties, as well as their efforts to attract more officers, among other topics. Next Thursday on Inside Government, we'll have the new Director of Veteran Services, Kevin Swab. He'll be in to discuss what his office does to assist local veterans. And that will be followed by Beyond the Front Page, featuring Donna Lamb, the Executive Director of the Schweinfurth Memorial Art Center. Not only to talk about what great things are going on at the center, but what's the state of the arts as a result of COVID across the board in Central New York. And over the next month, we have a full slate of guests in the studio, including Senator Pamela Helming, Assemblyman Brian McDelove, Cuyahoga County Legislative Chairman David Gould, I said, will be here. We'll be asking him about this subject as well. Cuyahoga Community College President Brian Durant, Stephanie Hutchinson, the Executive Director of the Auburn Housing Authority, and Melissa Cartner of the YMCA to talk about one of my favorite subjects, Summer Camp Onawasco Lake. And we'll also have Auburn School District's Jeff Parazola in and Lisa Green to talk about the Auburn proposed budget that will go before voters in May. And we will end our season with a small gap between guests and the elections with our Auburn Large School District Forum on May 3rd. Before we go, though, we would like to let you know that you can send us your ideas for future guests or questions to Inside Government or Beyond the Front Page. You can send them by email to cozguytho@aol.com or Inside Government or Beyond the Front Page at 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Cuyahoga Community College. We want to thank you for watching. I hope you have a good night. Have a great tomorrow. Be safe and wear a mask.